Hello, everyone. Welcome to this webinar that is hosted by the Disability Reference Group on Inclusion of Persons with Disabilities in the Humanitarian Action, and it takes place as a part of the Humanitarian Network and Partnership Weeks. Before we proceed, I would like to ask my colleague Maria from the International Disability Alliance Logistic Team to provide us with quick housekeeping notes about the webinar and its accessibility features. Maria, could you come in?
Hi, hello. Good afternoon, everybody. My name is Maria from IDA. I'm going to briefly explain some of the technical features of today's call. First of all, this meeting is being recorded. There is English sign interpretation and captioning in English. A CC button on the bottom of your screen in the meeting controls toolbar will enable the closed caption. If you need captions in the external link window, the link is already put in the chat box, but I will paste it again after I finish. The participants have the option of opening the microphone and video. Should you have any questions, kindly leave them in the chat box or Q&A section. Our team is monitoring the chat box and will try to respond to questions during the event when it's possible. Should you have any accessibility issues, please send a private message to the host account or email webinars@ida-secretariat.org. We request all speakers to kindly keep to the time and keep their cameras off if not speaking. We are asking that you speak slowly enough for the interpreters and captioners to follow. Thank you all and have a good meeting, and I will paste the link for the captioning again in the chat box.
Thank you so much, Maria. Hello once again, and welcome once again to this webinar in where we are going to discuss about coordination of disability inclusion within the humanitarian sectors to accelerate learning and opportunities for better delivery of humanitarian aid. As you know, within this humanitarian crisis, there is a huge need for humanitarian assistance. Almost 300 million are in need of humanitarian assistance by now. And this also came at the time where is a huge drop in the humanitarian fund is raised, which caused a lot of issues, in particular in related to delivery inclusive and impacted humanitarian assistance. Inclusive humanitarian action plays a great role in providing support to the people who are in high risk and delivering effective and quality programming that is done for those groups and with them at the same time. The Interagency Committee guidelines adopted in 2019 provide a significant and great guidance for cross-sectoral and sectors approach to deliver effective and efficient humanitarian action for persons with disabilities. The guidelines further provide explanation and assigned role and responsibility to each humanitarian actors, from the leadership of the humanitarian action coordination to the cluster leads to the organizations of persons with disabilities. A monitoring is done by OCHA at national level to see the disability inclusion within the coordination system that is undertook in 2022, shows that so far in 30 operation in where the study took place, there are 8 disability inclusion focal point, and also there is only 6 disability inclusion working group. However, at global level, we have the disability reference group, DRG, that is committed to foster and facilitate collaboration and cooperation between the different agencies, including UN agencies, international organizations, international and national NGOs, and organizations of persons with disabilities, in order to share capacity and enhance the leadership and participation of organizations of persons with disabilities. So the reference group, the Disability Reference Group, DRG, since its establishment in 2020, has been working to put the interagency committee guideline in action through collaboration and through providing this platform for exchange and sharing and fostering opportunities. Since the guidelines now reach 5 years of its age, it is the time to look about its implementation, in particular, how the disability inclusion is being coordinating within the humanitarian sectors. So that's why today we have this distinguished panel to see how the coordination of disabilities in the humanitarian sector is being done and when and how it's being done at global and national level. Through this discussion, we aim at seeing the opportunities, the gap, learning, and how to share good practice and to enhance further such coordination. We have a distinguished panel with us today, starting from national level to global level to cluster to donors to the organization of persons with disabilities to INGOs who are working on supporting technically and operationally this working group at different levels. So we will have in our panel Makabe Siddiqui. She's the women and persons with disabilities activist from Afghanistan. She's also co-leading the Disability Inclusion Working Group as the OPD's representative. She will be sharing with us the learning, the gap they face in the implementation and the work, and also the opportunities and recommendation, and how OPD's is being working in this role, would facilitate many exchange and facilitate the plan and the implementation of their work. After, we will have Ms. Mervat Shalabia. She is the head of the Interagency Committee Secretariat. She will share with us about how disability inclusion coordination is placed and structured within Interagency Committee work and structure. Following that, we will have Ms. Hini Stensenberg. She is working with the Finnish permanent mission in Geneva. Ms. Hini is an advisor on humanitarian migration and disaster risk reduction. Move on, we will have Ms. Notani Gregorius. She's working with OSHA. In particular, she's working as humanitarian affairs officers, looking at work related to need assessment and planning. She will share with us about how coordination of disability inclusion could foster more inclusive humanitarian program cycle, and what is the gap in that, and what is the opportunities. And she also can draw from the other intersectoral and cross-cutting issues they are working on, such as gender and so on. Moving on, we will have Ms. Wan. She worked as a coordinator for the camp coordination and camp management global cluster. She will share with us how the disability is being coordinated within the cluster work, and what is the learning, and what is the gap, and what is the recommendations that she could provide it from their work. And after that, we will have Ms. Orik last. Orik work with inclusion, with humanitarian and inclusion as lead of policy and development in the inclusive humanitarian action. Orika and his team in the humanitarian inclusion has done a comparative study to map the disability inclusion working group in the humanitarian sectors in different countries. So she will be sharing with us about this mapping study, what they found, what is the learning, what is the good practices, what is the gap, and how we can improve in terms of recommendations. And by the end, we will have our colleague who is also the co-chair of the working group, of this working group, the Disability Reference DRG, Kerstin Lang. She's sitting with UNICEF as a programming specialist focusing on inclusive humanitarian action. Kerstin will share about the DRG plan, and we will have amazing news of launching a new website for the disability reference group. So, and indeed, you will have myself as Aradi Abdullah. I work with the International Disability Alliance as advisor on inclusive humanitarian action and disaster risk reduction. Indeed, I'm pleased to be sitting with this great panelists with different experience and with different role, and I'm sure you will be happy with me to listen to them and have different perspective on this issue from the interagency committee, from OSHA, from donors, from OBDs, from HI, who have been working greatly on this issue. Without further ado, I will start with inviting Makabe to share about their work in Afghanistan. So Makabe, you have been in this role supporting the disability inclusion working group in Pakistan, in Afghanistan, sorry. And we know that in Afghanistan, the humanitarian issue has been for long times. And it is great to see an OBD sitting in the role of co-leading the disability working group. Could you share a bit about your experience, the recommendations that you have for us and for the audience here on how to foster better such inclusion and the role of OBDs on it? The floor is yours.
First of all, thank you very much. Good afternoon, ladies and gentlemen. Thank you very much for this opportunity to having me here to speak about the DIWG or Disability Working Group in Afghanistan and our achievement, the challenge, and so on. Yes, I'm a co-chair of DIWG and voice of the OPDs and NGO. Let me start about my experience to be voice of OPDs and NGO and the DIWG. Please let me share with you about a brief about DIWG. DIWG was established in 2021 and to make sure the streamline and coordination response by humanitarian and development actors in Afghanistan meet better needs for persons with disability. It means that we are a bit younger, our working group. So this working group is, as you mentioned it also, this group is co-chaired by Humanity Inclusion, HI, UNHCR, and Kabul Orthopedic Organization that I'm the co-chair of from this Kabul Orthopedic Organization side. And we have in this working group, we have more than 130 members, including UN agency, INGO, national NGO, OPDs, clusters, and also working groups, or they are member of the DIWG. And we have dual reporting on the ICT, RCU, and to support both humanitarian and development action in Afghanistan. What will be, sorry?
I'm fixing the glitch. Just a second. Sorry. It's going to be continue talking. It's going to be up in a minute.
Okay. Okay, thank you. No problem. Let me say about the background on person with disability in Afghanistan. As you know, decades of war and conflict in Afghanistan, it all lead the peoples to disability. The prevalence of rate of the disability in Afghanistan is 78.9%, and including that 24.6 mild and 40.4 as moderate and 30.9 severe disability as a TFA in 2019 reported. Among this person with disability, 33.1 have multiple disability as reported, and among among children aged 2 to 7 years age, and 70.3% have mild and moderate or severe disability. Severe disability are more prevalent amongst the women and girls, leaving them more vulnerable. Women with disability are facing double challenges. As you know, the situation of women in Afghanistan, once they are facing double discriminations, once because of their gender and other is because of their disability. Disabilities, specific prior and access employment, services, and education, as well as increasing the economical vulnerability, such as limit infrastructure and accessibility, inadequate healthcare, discrimination, and stigma, which is still existing in Afghanistan against persons with disability. Households with members with disability facing heightened vulnerability exhibiting 25% higher debit levels, and children lower is also more prevalence on such household. 23% reported at the last one. By at least one by working outside the compared with 15% of the national average. This all is the leading, the increasing the. This all is the situation of the and the statistic of person with disability in Afghanistan. DRG activities to promote disability inclusion in humanitarian action. Please let me say what DRG did and are doing now. DRG promote the optionalize of IACS guidelines for inclusion of persons with disability in humanitarian action. Coordination disability inclusion efforts through the regular meeting with cluster, NGO, focal points, and disability inclusion specific actors, OPDs, as well as a mapping of disability actors and OPDs. And providing technical support to cluster working groups and partners by developing technical guidance, reviewing the ICCT and cluster working group tools and publication, including the humanitarian need and response plan, and also Afghanistan Humanitarian Fund HF proposals to ensure the inclusive ensure inclusive humanitarian humanitarian action. We're reviewing many proposals to make sure in different sectors in different fields to make sure that they are very inclusive to be inclusive for persons with disability, and also building capacity of humanitarian actors through organizing didactic training and supporting the cluster, as well as working groups on ministering and disability inclusion consideration into capacity building initiative. And also advocating for the right of persons with disability through organizing targeted advocacy initiatives and implementing good practice. Engaging of OPDs in DRG activities and overall humanitarian program cycles, supporting their empowerment and advocating for their participation in humanitarian action. The recent achievement of DRG, developing guidance note and disability inclusion for Afghanistan, and mapping of disability service in Afghanistan, and mapping of OPDs in Afghanistan, and engagement and inputs on HNRP process, revise of MRT, multi-sectorial rapid assessment tools, and minimum standards for quality programming, including in coordination with AAP and GIHA, a working group. Advocacy for 20% top up for persons with disabilities to MCPA under the discussion by the HCT. It's under discussion. And regular briefing of and presentation on disability inclusion to cluster working group, and youth working group, and cash working group. Provided disability inclusion and accountability training to health cluster, about 70 organizations participating in their AP focal points, and who is have the role to inclusion with the person with disability. It is that we are happy it will be have a good it will be a good achievement, because all the NGOs knows how to about the inclusion of persons with disability in their program, and they will prioritize in their strategy and when working. Let me also speak about some challenges and concentrate here as well. The first challenge that we having lack of adequate social education and health services network supporting the multi-facet needs of persons with disability, limiting referral options. And the other challenges, persons with disability are not sufficiently meaningfully engaged through the humanitarian programming. And distributed progress on the disability data available. There are still gaps on the reliable data on disability across the country. The Washington DC group question are and constantly using across the assessment and identification of prior and enablers of often omitted. This lead to a challenge when advocating for MCPA top up. It was a challenge for us in advocacy. The DFA, as you know, the situation in Afghanistan, all the regulations, law is changing. The DFA has posted the issue of renewal of OPD's license, and still their activities almost stop. because they don't have updated lessons. And also disability for being integrated on HNRP. There is lack of available sources for dedicated personnel and support for activities for DRG. Insufficient resource to address the limit capacity of humanitarian actors in disability inclusion, disability first progress achieved by DRG. Lack of technical resources on regional and provincial level to ensure the disability inclusion, coordination, and response. According to this challenge, we have also the DRG have some recommendation. The first recommendation is the disability inclusion and coordination, therefore, should be high priority for whole humanitarian community, including UN agency, INGO, and international donors to give the gaps, given the gaps and prevalence. And also advocate for inclusion of WGQ as well as assessment of barriers and enablers on the sectorial assessment tools, ensuring the collection of the disaggregation data across all the humanitarian actors, provide didactic training to this end. Work with AAP working group and OWAS to ensure communication and complaint and feedback mechanism are inclusive and accessible for all. It's also mostly our comment on the proposal as well, and for implementers. Promote and ensure the resource and available for meaningful participation and engagement of a person with disabilities through the humanitarian program cycle and priority setting, and ensure resource for human resource capacity building and working for DRG at the national and provincial level. Building the network and enhance the capacity of organization for persons with disabilities, as well as local NGOs. Showcases good practice on disability inclusion and encourage relocations. This all from my side. If there's need for further information or any question, I'm there. Thank you very much.
Thank you so much, Mabake. Indeed, it was a very intensive presentation sharing about the success, and indeed it was amazing success, providing input to the key humanitarian document, need assessment, response plan, and so on, and also making advocacy on key things, and also conducting capacity sharing activity, mapping services and OBDs, and also promote the OBDs engagement in the humanitarian sectors. And thank you for sharing the challenge that you highlighted. And indeed, it is a challenge that we need to work on it. And I think these challenges are common in different countries. Maybe, yeah, we can foster cross-country communication to see how the different countries are challenging those are overcoming these challenges. And thank you for the recommendations as well from your experience. And indeed, in particular, I like the recommendation about working with AAB to have the compliant mechanism more accessible for everyone, including persons with disabilities. So thank you for providing this example from national level. Let us now go ahead to the international level and the global level to hear from Madame Mirfat Chalavia. Madame Mirfat, we would like to see, as you are sitting in the Secretariat of the Interagency Committee Guideline and leading the Secretariat work, we would like to see how the Secretariat is featuring disability coordination, disability inclusion coordination within its work and structure. So Marhab, and the floor is yours.
Thanks a million, El-Radi. Really a pleasure to be in touch with you, and also a pleasure to be here with all of the colleagues online, and of course to share this panel with Mahpikai, as well as the other colleagues that will be speaking shortly. So of course, this is an important discussion. It's an important issue that is also a priority within the Interagency Standing Committee. And before I get to this point around the role of the Interagency Standing Committee, I wish to perhaps state a few points for the sake of colleagues, of course, online. I'm sure there are colleagues that are very familiar with the issues, and there are colleagues that are still relatively new. So for the sake of colleagues that might be less familiar with the issue, I want to share perhaps some statistics just to put things in context. So it's important to be reminded, colleagues, that over 1 billion people around the world live with some form of disability, 1 billion people. And this represents about 15% of the global population. And these statistics are based on the World Health Organization's analysis. And despite these numbers, persons with disabilities disproportionately face barriers in accessing basic services, including those provided during humanitarian emergencies. The reality is that during crises, persons with disabilities are amongst the most affected and the least heard. They are 4 times more likely to be left behind or ignored in emergency responses. Such exclusions is not only a loss of potential, but it's a violation of fundamental human rights. Inclusion of persons with disabilities in humanitarian action has become a critical focus in emergency response. Of course, this is welcome, and there's been good progress over the years. And again, I was very happy, of course, to hear from my colleague Mahpikai in terms of the work being done in Afghanistan and Syria and many other locations around the world. And again, to underscore that this is obviously a priority for the Interagency Standing Committee. And for colleagues that are not familiar with the Interagency Standing Committee, this is a General Assembly mandated body. It is the only General Assembly mandated body that includes UN organizations, along with non-governmental organizations, the World Bank, IFRC, ICRC. And it is the composition of this group is really the executive heads of some of the most influential and organizations involved in humanitarian action. So it's quite a critical group, and it is the group charged with the coordination of humanitarian action globally. It is important to note that, of course, inclusion of persons with disabilities in humanitarian action is a priority for this committee, and this is highlighted in a number of ways. First, it is one of its strategic priorities featured across all of the strategic priorities that is covered by the Interagency Standing Committee, particularly as we underscore the importance of leaving no one behind. Also, as El-Radi emphasized or highlighted, through the Interagency Standing Committee, the first ever ISC guidance on the inclusion of persons with disabilities in humanitarian action was endorsed in 2019. So it's been 5 years, and of course we're gonna, we've heard some of the progress, but also some of the significant challenges in terms of translating policy to action, which I'll also touch upon shortly. Another way that, of course, inclusion of persons with disabilities is highlighted and key in the ISC structures is through the Global Cluster Coordination Group, the GCCG. And for the colleagues that are not familiar with the Global Cluster Coordination Group, this is a group that is co-chaired by OCHA and with the rotational co-chairmanship with one of the NGOs. And it is a group that is composed of the Global Cluster Coordinators who offer advice and operational support to the various clusters and the intercluster coordination groups at the country level. So this is a critical group that is also charged with translating or interpreting global policies to practice on the ground. And this is a critical group to ensure that the issues of persons with disabilities is addressed and highlighted and prioritized on the ground. There's also a lot of ongoing work to better integrate disability inclusion in the humanitarian program cycle. And I'm glad to see, of course, Nathani from OCHA online, and I'm certain, Nathani, you will have the chance to get into more of the specifics in terms of how this is being done through the humanitarian program cycle. Also, another good example is around the interagency humanitarian evaluations. Over the past years, there has been progress in ensuring that the disability issues are considered in all stages of the evaluations. And very shortly, we'll have 2 evaluations that will be concluded and published, one for Afghanistan and one for Northern Ethiopia. And I look forward to seeing the evaluation and encourage you to see it, because again, this is good to see that the issues around disabilities were considered in every stage of these 2 operational evaluations. And likewise, also in terms of centrality of protection, some of you must have seen or might have seen the independent review with regards to the response, with regards to the centrality of protection and the implementation of the IEC's protection policy. And centrality protection requires us to understand why certain population groups, such as persons with disabilities, consistently face heightened risks in various contexts. And by designing and delivering humanitarian responses that address the needs of these groups, we can avoid inadvertently contributing to their exclusion. And the final 2 points that I will mention in terms of, again, the opportunities that we have to better integrate and prioritize disabilities and humanitarian action is efforts around localization. Also, to the Interagency Standing Committee a couple of years ago, we launched and endorsed the first ever guidance on the meaningful inclusion of local actors in humanitarian coordination mechanisms. And this is a critical guidance, but we are challenged, and it's important to be also honest in indicating that although there's been progress on localization, but we're far from where we need to be in terms of the level of representation, the meaningful participation in terms of also the decision-making capabilities, but to enable the power sharing for local organizations and these various coordination mechanisms, including groups and organizations that are representing persons with disabilities. And last but not least is, I would say, the common denominator and the common thread across everything is around the issues with regards to accountability to affected people. And I always say that if we are indeed, and we make an effort and we think differently and operate differently and behave differently as a system and as organizations to ensure that we're more accountable to affected people, then all groups, including persons with disabilities, are going to receive the support, the protection that they so rightly deserve and require. So a lot of efforts, some of you might have heard or been exposed to the Emergency Relief Coordinator. It was the Undersecretary General for Humanitarian Affairs for OCHA, the flagship initiative, which is specifically around a step change around how we can better ensure that we listen more and respond more effectively to the expressed needs of communities, including, of course, persons with disabilities. My colleague Mahpikai mentioned quite a number of challenges, and I want to avoid repeating some of the good examples that she highlighted, but translating one of the issues which I highlighted earlier is around the need to translate commitments to action. This remains a challenge. And despite all of the efforts, we are far from where we need to be. We still need to do more around the issue of underrepresentation and decision-making. We still need to do more around addressing data gaps on disabilities in affected populations. We still need to do more in order to address the persistent barriers in physical and programmatic accessibility, just to name a few examples. I will perhaps conclude here by saying that our goal is obviously to ensure that inclusivity is not an afterthought, but a central component of every strategy and intervention. It is about transforming our mindset to ensure, to recognize it is a critical issue of rights, dignity, and equity. And I want to conclude by saying a huge thanks to the DRG and the great collaboration that we have with the DRG, and really a shout out to my colleague Isabelle Demusy, who's really been central to this collaboration with the DRG and really been central to the discussions, both in the Interagency Standing Committee as well as OCHA, to ensure that persons with disabilities are an integral part and integrated across all aspects of humanitarian action. Many thanks again, colleagues, and I look forward to staying in touch to make sure that we move the dial on this important issue. Thank you.
Shukran, Mirfat. Thank you so much for your great presentation. And I'm pleased to see that you already highlighted the challenge that face persons with disabilities, so providing concrete statistics and also how the interagency committee is working on overcome those challenges through mainstreaming disability in its work and structures. And in particular, I like when you highlighted about the localization agenda and how organization of persons with disabilities will be counted and should be accounted within the localization agenda and benefit from it. And also thank you for being honest and sharing some challenges that we all face so far. And hopefully the new structure of the interagency committee will be an opportunity to better or further overcome these challenges and enhance the work on disability inclusion within the interagency committee. Thank you so much once again, Mirfat, and really happy that you have been with us here. So now let us hear another perspective from donors. Let us hear from Finland. We have Hini. Hini, we know that Finland has a long history in being a donor, providing a lot of support on disability inclusion agenda, as well as humanitarian action agenda. So we would like to see your perspective as a donors on how coordination of disability inclusion within the humanitarian sectors is being so far. From your perspective, from perspective of donors, what is your observation? What is the aim to see in a better place or doing in another way? So the floor is yours, and indeed we will be happy to hear from you. Hini, welcome.
Thank you very much, and I do hope you hear me well. So many thanks already, and thank you for having me. I'm very happy to be part of this great panel and event. So I will start by sharing our perspective of the positive developments so far and some of the remaining gaps, and then mention a few actions that Finland is committed to do. So firstly, from our perspective, it is clear that since the launch of the IS guidelines for disability inclusion in humanitarian action, huge progress has been made. Many of the large humanitarian organizations now have a strategy on disability inclusion, as well as a dedicated advisor. And in key humanitarian documents, references to disability inclusion can almost always be found, which is really excellent and a big change from within a couple of years. Even accountability has progressed, as the UN has the UN Disability Inclusion Strategy with its indicators that all UN agencies have to report on. So these are, one could say, systemic changes. And without systemic changes, disability inclusion will only remain a voluntary effort. It will be in the nice to have category and not in the must have category. Unfortunately, if you visit country operations and ask about disability inclusion, and we've had just a wonderful presentation from someone who knows all of this so much better than we do. But if you visit country operations, you will find that the humanitarian system keeps relying mostly on the voluntary contribution of some organizations and staff. And there is little that is systemic and must have. Especially looking at the humanitarian coordination system, whether globally or at country level, disability inclusion, or actually inclusion in general, it's not officially the responsibility of any cluster or official IASC entity. As we just heard, important work is done in different places, and inclusion is mentioned as an underlying theme in IASC's work, but it is, in fact, no one's designated responsibility. Also, no lead agency exists to ensure that the topic is consistently on the agenda and that there is technical development on what disability inclusion should look like in humanitarian action. And OCHA, and I'm very sorry for naming one organization here, but since the event is about coordination, they really do play a key, crucial role here. So OCHA, that is mandated to coordinate and systematize the way that the humanitarian system analyzes needs and makes strategic response plans, does not have sufficient resources for disability inclusion at headquarters or country level. There is, for example, no focal point network within country operations, and training on disability inclusion for their staff is not mandatory. All the above means that in practice, at country level, humanitarians who would want to implement disability inclusion will have trouble getting technical support on how to actually do this. In those countries that have a disability inclusion working group, its existence and sustainability is often context dependent, as the group is many times dependent on active individuals who are doing really, really amazing work that has great impact, but again, it is not systematic. Added to this, with the funding cuts that the sector is facing and the goal to streamline processes at the HCTs, we are concerned that the enabling environment for disability inclusion will be further reduced. Country level budgets, staff that work on disability inclusion, some of the challenges were already mentioned. We've also seen examples of this. So what is our role as a donor in all of this? For Finland, disability inclusion humanitarian action is a priority. We are also a donor that tries to provide a large part of its humanitarian funding as flexible as possible. So a few examples of what we do. We encourage our multilateral partners, that is the UN and the Red Cross and Red Crescent movement, to have disability inclusion strategies, and we follow up on them by having a session on disability inclusion in our yearly partnership discussions. And this is especially important because it ensures that the higher level management engages in the discussion. We are also influencing the allocation, or trying to influence the guidance on allocation criteria and enabling systems used by SURF and country-based pool funds. We have included disability inclusion in our monitoring questions when visiting operations, as I mentioned. The Finnish CSOs that we fund, they have to report their beneficiary data, disaggregated by disability. And then to be coordinated, more coordinated among donors, we have organized capital level meetings on disability inclusion. And together with Australia and the UK, Finland co-chairs a broader group of friends to the Humanitarian Disability Charter in Geneva. And lastly, to address the gaps in the current ISC coordination mechanisms that we have observed and I have just outlined, we are now in the process of reflecting with other interested donors what would be the most impactful way forward. I think addressing the humanitarian leadership will be the key here. And in all of this, we of course work very closely with OPDs. And I'd like to also mention that sometimes we hear assumptions of what donors want. And that is assumed that for donors, efficiency means maximal amount of persons reached as quickly as possible and at the lowest cost. And if you hear this, please have that conversation on whether that is actually true, because at least for us, humanitarian action is not effective unless it is inclusive of persons in the most vulnerable situations. And sometimes that is not the quickest way forward, and it requires proper resources. So to conclude, if humanitarian action is to be truly principled and impartial, as well as efficient, we need the systemic solutions for disability inclusion from humanitarian leaders. Persons with disabilities in humanitarian contexts have a great potential to contribute to their communities, and we need to help to break down barriers to enable that. Thank you very much.
Thank you so much, Hini, for your perspective. Indeed, we experience a great achievement in terms of policy, guidelines, and strategies, and so on, as you highlighted. However, also as you highlighted, we need to transform those policy guidelines and so on into practice, so we can touch that at national level, where people are in crisis would like to see the impact of those policy, and that in particular, the question that we face many times as persons with disability, from persons with disabilities, when we go to the field, they say, yeah, you have interagency committee guideline and you have that guideline, but we need to see the transformation in the response. We need to see the transformation in the services, in the inclusion, and so on. And that in particular will be a big concern, as you highlighted, as we are talking about the cut in the fund for the sectors, and the cut should not touch people who are most in need for this. And thank you for highlighting that at donors. You need to see people who are in heightened risk are included to see that your fund is really impacted and effective. Thank you so much, Hini, once again, and let us see another perspective. So today we have different perspective: national coordination team of disability, we have the interagency committee at global level, we have donors, and let us now see how disability is being coordinated within the UN Coordination Office, OSHA. And we have Natani will tell us about how disability inclusive coordination could better foster the assessment, need assessment and response plan, and what is the gap in that, and what is the learn that we can take from other cross issues such as gender and so on. Natani, the floor is yours.
Thank you so much. First of all, thank you so much for the opportunity to be in the panel for this session. Just 1 second, let me share my screen. All right, I hope you can see it.
Yes, I assume.
Thank you. Sorry. So my name is Natini. I'm a Humanitarian Affairs Officer from OSHA, and I work in the branch, which is called Assessment, Planning and Monitoring Branch. I know it's quite a mouthful. We have several portfolio within the branch, including the humanitarian coordination architecture, the cluster system that many of you are familiar with, and we have the representative from the global cluster with us today as well. And also the custodian of the humanitarian program cycle that I'm sure many of you are involved as well at the country level. So this is going to be the framing of my presentation or my intervention for today. So it will be focusing on 2 things. It's about the coordination setup, an overview of that on disability inclusion. And the second part is about how disability inclusion is reflected in the 2024 HPC, the humanitarian program cycle. So I know it's a lot of data point here, and I apologize for the small font, but the thing is that I understand the presentation will be shared with all of you, so you'll have all of these slides as well. Just to mention that in one of the work that my branch undertake every year is what we call the annual coordination mapping exercise. And this is an exercise that involves all of the cluster and area of responsibility globally. And also in OSHA focal point in the country offices, who are the focal point of the SGT and the intercluster coordination group in different countries. So this exercise will do the mapping of what are the coordination mechanisms existing in all of the humanitarian operations around the world. And the exercise is happening on the annual basis. In the exercise, we also do the mapping of the technical working groups, the different technical working groups existing in a country, including those focusing on disability inclusion, and also doing the mapping of which country the SCT has mainstreamed the guidance, the ISC guidance, and which country has disability focal point in place. And the below is the findings of 2022, which is the latest year or the latest comprehensive data that we have. The exercise for 2023 is currently underway, so we're taking a retroactive perspective of the mapping. So based on the finding of 2022, I think you already mentioned at your opening remark that we saw the increase of the number of the SCT country, SCT promoting disability inclusion in humanitarian action and using the IAC disability guidance in their operation to guide their work on this. So comparing from 2021, it was an increase to 80% from 63%. And in terms of disability focal point, is present in 8 countries or in 8 operations, and this is similar to the findings of 2021. And 6 operations have disability working group, which is an increase from 4 in 2021. And you saw the list of countries that group exists, and then we had a colleague from Afghanistan with us today as well. So in terms of reporting line, this is quite interesting because half of the working groups or the 6 disability inclusion working groups in the country, half of them reported to the ICCG, and the other half, the remaining, reporting to a specific cluster, particularly protection and health. And another interesting fact that we found in the data is that disability inclusion working groups were predominantly led by the NGOs, not so much of the UN, compared to other working groups existing in the country that predominantly led by UN agencies. The mapping also cover other types of cross-cutting issues, not only disability inclusion, so including gender, PSAA, accountability to affected people, risk communication, and community engagement. So we map all of that and also show the reporting line, whether they're reporting to the SCT, to the cluster, or to the ICCG. And different countries, they have different coordination set up on cross-cutting issues, including disability inclusion, as you see in the previous point. But I think it's worth highlighting that there's one country in 2022 that has a collective working group on multiple cross-cutting issues, including disability inclusion. And that group report to the ICCG, and that was DRC. The information we have as of now is that that group no longer exists because the person who used to manage that group left. But the initiative was greatly appreciated by partners. And this is also linked to the session we had this morning about the coordination of cross-cutting issues in general. And I hope that some of you also participated in that webinar. So moving on to the reflection of disability inclusion in the HPC. Some of you may be involved and aware. I think the colleague from Afghanistan also mentioned about this new HNRP that was introduced last year. And this is a combination of the 2 documents that used to exist. One is the Humanitarian Needs Overview, and the other one is the Humanitarian Response Plan. So last year, a new template was introduced, and it's called HNRP, Humanitarian Needs and Response Overview. So this is part of the lightening effort that we try to do in order to free up the time of the colleagues, especially at the field level, for them to invest more in other aspects of the programming, particularly those related to inclusive and quality programming, including community engagement and access negotiation, the operational issues. And now for 2024 cycle, half of the operations in the world adopted this merged template of the HNRP, so 13 out of 24. And we found that the countries that have adopted this merged template of HNRP, the number of days that required to run this process has significantly reduced by 1.5 months, which is quite significant, so that the colleague can spend that time on other important things, including community engagement with people with disability. And the countries that opt for the traditional HNO-HRP, the process took additional 11 days. So I think there's a clear benefit in terms of saving the time for the countries that doing the HNRP. And also part of the lightening process that we saw the shorter length of the document. So we have an average of about 85 pages for the document this year for 2024 compared to about 300 pages from the previous year. And we saw that the particular situation and needs of vulnerable population, gender, people with disability, older persons, and those displaced is still reflected either in the document itself or as a link out from the document. So when we have a preliminary desk review of the document that was published as of the end of March, we saw that all of the document, like 100%, have people in need and people targeted data disaggregated by sex, age, and disability, either as a percentage, and some of them using the global estimate of 15%, and some of the countries actually providing the actual number of people with disability. And in addition to that, we saw that data disaggregation of PIN and targeted also provided at different level. Some country, Afghanistan, providing that disaggregation, including disability disaggregation at strategic objective level, or by population groups in Ukraine, in Mali, and by state, such as in Myanmar. And so many of the countries, or many of the HNRP have data disaggregation beyond demographic factors, sex, age, disability, and also including the status base of the population, for example, IDP, returnees, refugees, depending on the specific characteristic of the context. And Myanmar, for example, has a systematic engagement with OPDs during the HPC for the last 3 years, and I think this is one of the good example that we can learn from. And we have a session on Monday organized by Disability Advisory Group, where we have the representative from Myanmar, from Disability Inclusion Working Group in Myanmar, also sharing the experience of how OPD were engaged in the development of the HPC in the country. So I'm just gonna end my intervention by providing some food for thought. That, you know, perhaps now we need to move forward, move toward a holistic approach to quality and inclusive programming. And we talked about that in the morning session on the coordination of cross-cutting issues. And the shift must be from the document, that the HRP document, what is written in there or what is not written in there, to the real change on the life of the people that we try to serve or we seek to serve. And in terms of the representation in the coordination mechanism, I think it would be good to also have some reflection whether the extension of the HCT membership, for example, which according to the coordination mapping exercise that we did, we saw the increase of the number of members in the group from 25 in 2019 to 32. And many of the countries have, each of the thematic advisors have a seat at the table as well. And whether or not it helps improve the accountability and inclusivity of the response. And finally, whether there's any other initiative that we could leverage on for disability inclusion or to strengthen disability inclusion commitment. For example, the integration of disability inclusion in gender with age marker that was done in 2021. You know, perhaps this is something that we can learn from in terms of the progress and challenges over the last years in implementing that. And finally, as Merwat mentioned about the flagship initiative, that is a step change in how we would like to deliver humanitarian assistance in a more inclusive and accountable manner. And also the new ISC AAP framework that was endorsed in December last year. Maybe this is also another initiative that we can leverage on to strengthen disability inclusion in the response. So I'll leave it at that. Thank you so much.
Thank you so much. Indeed, it was a great presentation. Many thanks for sharing about mapping the existing disability inclusion group that you have done in 2022, and indeed also to hear about engaging with OPDs in some event and also engaging OPDs in the humanitarian program cycle in Myanmar and other countries. And indeed, also many thanks for putting different questions in the table for reflection. And indeed, these webinars aim to that, to open this discussion for reflection, to see how we can better accelerate disability inclusion coordination within the humanitarian system, and all this thought together along with the good practice and the different study that is already in place will contribute to that discussion. So many thanks once again, Notani, and to OCHA as well. So let us move ahead also to hear from a specific sector to see how the disability is being included and coordinated within the sector, which is CAM coordination and CAM management, CCCM. And we are glad to have one here. She is leading or coordinating the CCM global cluster, and she is working or sitting with IOM, the International Migration Organization. One, could you tell us a little bit about your work on coordinating disability inclusion within the CCM cluster and the key learning from that coordination work? The floor is yours.
Thank you so much, Ardi. And I apologize first off that I seem to be having problem with the camera on my laptop, so I'm unable to turn it on. But I hope that you can hear me well. Please let me know if at any point I go a little bit too fast. Thank you so much for the invitation for us to share what we have been working on over the past couple of years to improve how we engage with OPDs, but also how to improve inclusion and engagement with persons with disabilities as well. There are 3 areas of work that we have been focused on. The first one is to understand and measure how we are doing and what we're doing well and what we need to improve on. The second area of work is about the know-how, like making sure that we know how to improve the different areas. And this is where we work a lot with the reference group or with IDA, for example. And then the last area is about increasing and improving visibility and collaboration. So first, in the first area is about understanding where we are. I think presentations from Mervat and also from OCHA colleagues look at how we're doing in terms of capturing the need and the specific vulnerability in the humanitarian needs overview and response plans. We also do similar analysis and review how the sector is doing in terms of having the right data, doing the appropriate analysis, and also understanding what the different needs and what kind of responses are. We started doing this with the support of UNICEF and IOM in 2022. And you know, to be fair, we were not so great at it. But I guess that's the important part, is to set the benchmark and the baseline of where we're starting from. Following that, we developed a tip sheet with recommendations and examples to share with our cluster coordinators to make sure that they look at, you know, understanding the need goes beyond just listing persons with disabilities as a vulnerable group, and understanding that we need to do more in terms of identifying risks, barriers in accessing services, and as well as the ability to participate and feel represented in the camp management or site management processes. And also to understand and reflect better the diversity among persons with disabilities and the intersecting factors such as age and gender. We also work to advise our cluster coordinators on how the CCCM chapter in the response plan should describe more specifically how persons with disabilities can be engaged as actors in the response, whether it's through partnering with OPDs or working with representative committees and camp committees in sites, and how to build capacities of persons with disability as well to participate in the response. The other area of work where we look to improve is also creating a tip sheet that accompanies our minimum standards for camp management. Our job as in coordinating and representing people who've been displaced is also to ensure that they're able to participate and be represented even during displacement. I'm going to share a link in the chat which goes to the minimum standards for camp management. In there, you can find the annex that looks at disability inclusion checklist for CCCM actors and how they can better integrate and the needs of people with disabilities, but also how to better work with OPDs and persons with disabilities. This the last area of work we've been pushing on around increasing and improving visibility and collaboration. It's something I'm particularly excited about. And since last year, we've had sessions, and thank you again to Aradi for also facilitating that session with our colleagues at the global CCCM meeting in 2023 in Geneva last year. We had a session that focused specifically on how CCCM actors can work and collaborate with OPDs. I think understanding that even though we work across different sectors and look at protection, but also accountability when it comes to displaced communities, we're also not specialists in any way. And it's important that the collaboration we have with OPDs can also help us further the engagement and ensuring representation and contribution to the decision-making in camps or displacement sites. We've also pushed on also that this last year and this year, we're looking at revision of the mass evacuation in disaster guidelines. And because of our engagement with the reference group, And with IDA, we've also been able to do a consultation with different OPDs to look at how we can make sure that emergency evacuation can also, and procedures and plans that we support the government to develop can also take into consideration the risk and the need and mitigation measures that can be put into place when it comes to persons with disabilities. So this is some of the different works that we have been pushing on over the past couple of years. And so I'm gonna stop my intervention here. I'm happy to also take any questions in the chat if you have any. Thank you very much.
Thank you so much, Juan, and keep the good work on including disability. Including disability is in different area of the work, such as collaboration with OPDs, collaboration with other clusters, and changing the template to better reflection disability inclusion. And indeed, that by the end will all contribute to the better cooperation and better coordination of disabilities within the cluster itself and across cluster with other cluster in place, and also with OPDs and other agencies. Thank you so much once again. And let us now hear from Orik. Orik is working with humanitarian inclusion, as I shared earlier, leading on policy and development. And Orik was working on a mapping study to have better understanding of the disability inclusion working group at country levels. We all know that HI massively support most of the working group. So it will make sense that we heard from them, from their experience, and also from the studies that they have conducted. Orik, could you kindly share with us the key finding from the study about how the work group feature work, where, for how long, who's supporting them, and what is their structure, and so on? And any recommendation came out from this study? The floor is yours.
Thank you very much, Aradi, and thanks for giving us the space here to share the key findings from two studies. One was a mapping and another one was a comparative case studies. As a quick background, so HI works in 20 humanitarian and refugee responses. We do provide direct assistance, but in parallel, we also support efforts towards a disability inclusive humanitarian or refugee response. Over the years, we received a lot of requests from humanitarian and refugee actors, like coordination teams, clusters, AAP colleagues, or operations for capacity development, technical support, also to support enhancing meaningful participation of organizations of persons with disabilities and their empowerment, as well as on improving the availability and the quality of disability-related data collections. So as a response to that, because it's not something one agency at all should take forward, we started together also in some countries with HelpAge to set up first interagency mechanisms for coordination since as early as 2010, while we support most of them in the last 5 to 6 years. However, looking at it, we realized that despite those joint efforts, there is still, as was also mentioned by Haney, a bit of an unsystematic integration of disability inclusion in the humanitarian structure at country level, and coordination over time. So we took a bit of a step backwards and we undertook this mapping and comparative case studies to enhance the evidence around the integration of disability inclusion. So with the mapping, we wanted to understand what type of mechanisms exist, also including, not only working groups or technical task forces, but also disability inclusion focal points, whether and how they are integrated or linked in the humanitarian or refugee response system, what objective main activities results were achieved and who was engaged. And then in a second step, to look a bit deeper with case studies, what are good practices to integrate disability inclusion better? And with a particular focus also on the must-do actions as recommended in the Interagency Standing Committee guidelines on disability inclusion with regards to data, capacity development, meaningful participation and leadership indeed of OPDs and the removal of barriers. So in the mapping, what we found is that also we looked at the data mentioned already by Natalie of 2022. We also took, a sample of 31 humanitarian response plans and refugee response, large-scale refugee responses. And then we did follow-up interviews with key informants from there. And what we found is that out of those 31 big sample, only 13 locations, so about a bit more than a third, did not have any disability inclusion working group or mechanism. In 6, which were reported to have disability inclusion focal points or working groups from the OCHA mapping, we found out that there was no current activity. So, giving already an indication of this not being very systematic, depending on the resources available. And in 12, so a bit, a third, we did find that there is disability inclusion focal points, and often in combination with working groups or task forces to coordinate them. And 3 out of those were co-led by organizations of persons with disabilities. Moreover, Iradi, you were asking how they are connected. There are 5 of these 12 were connected to the protection cluster or sector working groups. 2 were working at the level of intercluster coordination, like the case we heard from Apakai in Afghanistan. 1 localized mechanism was linked to the education cluster, while a third was really not clearly linked and rather outside. And the objectives were largely around, in 9 out of were around improving humanitarian programming, strengthening the disability inclusiveness in the humanitarian program cycle, with also improving data collection, as well as raising the awareness around disability, also as shared by Mapakai, quite similar to what was presented from Afghanistan, and to improve the coordination overall, and to facilitate participation of organizations of disabilities and do related advocacy on their rights. And similarly were also the activities. So afterwards, we did a selection of case studies where we had richness of information, diversity of approaches and results achieved. And we picked 3 contexts where there were age and disability working groups: Bangladesh, Ukraine, and Venezuela. 1 where there was a localized mechanism, and the 5th one where was Afghanistan with a disability inclusion working group. So what were the findings? The accomplishments and good practices in 4 out of those showed that if such a mechanism is available, where often they're working with focal points from the clusters like in Afghanistan or in Venezuela, you could really find that capacities were strengthened of operational partners. Also, organization of persons with disabilities, engagement was enhanced, as well as their empowerment to play a role. There was also a good integration through the protection cluster or the interagency coordination group or team with the overall response, and really highlighting here the harmonized approach between the humanitarian program cycle, perception of disability, the data collection, and the response planning, also shown by Nathan. Supporting factors, perhaps to highlight 3 key, was finance, to really have the finance resources to finance activities of these mechanisms, but also importantly, the coordination role. And the use of the YAS guidelines on disability inclusion was found to be really effective in 3 out of them. And I mentioned already to have disability inclusion focal points from operational partners, as well as the coordination and programming was really important to get traction on the response planning, data collection, and actually being effective also in the response, as mentioned by Merwant, to allow for listening to the communities affected. What were the common challenges? Just to mention the top three. So because of the limited resources, despite they had one, we could see that the technical support requests on reviewing data collection tools or other standards of sectors was really limited. So the supply could not meet the demand, and there was insufficient resourcing for reasonable accommodation to support organizations of persons with disabilities to participate. The leadership and localization, we would often see, as was mentioned already, NGOs really carrying the main burden, I would say, of fundraising. And we would not yet see sufficient, leadership yet of OPDEs and the UN. And it was a patchy picture of integration in the coordination structure. And last but not least, importantly, highlight that there was a lack of global coordination of coordinators and commonly used and usable tools. So accordingly, the structural recommendations from our side are really to have time-bound, they don't need to be there forever, task forces or working groups to set the foundation per refugee or humanitarian response to really make disability inclusion work and operationalize the IAS guidelines on the different levels. That is instrumental to harmonize and systematize. Also, it should be gap-based and structured. So not just to meet monthly, but to really have a clear understanding of the gaps in the system. And to have a continuity of financial and qualified human resources is key. And especially in this time of reduced funding, that's really, really important to highlight. We've seen some promising examples where it was put as a standard allocation in pool funds. And we think that's really a very promising practice to take forward. And a three-party leadership between UN, NGO, and local OPD, that is absolutely fundamental to make localization work even better and be effective in the future. And last but not least, have a coordination at global level. And with this, I'm ending. Thank you.
Amazing. Thank you so much, Ulrika. Can I ask you a favor? To share the link for those study in the chat. I'm sure many people will here would like to see and read them in full. So many thanks for conducting the study and sharing with us the key summary about it. So mindful of the time, I will just go ahead directly to the casting link. Casting is the third co-chair of the Disability Reference Group, DRG. Casting will quickly share with us a bit about the new website that we have for the DRG and the key feature we have in the website, and maybe a few words about the new work plan casting. The floor is yours.
Great. Thank you very much, Alradi. Really excited to be here and to hear all of the great interventions today. Now we have 2 minutes, so I'm going to share with you something very exciting in a very short amount of time. So for the last few months, as DRG members would be aware, we have been working on developing a new website. So we were previously hosted under the IDA website. We now are just about today to have a soft launch of our new website, which we very much intend to be a space for all DRG members and humanitarian actors and disability rights advocates more broadly to be able to access resources on disability inclusion in humanitarian action and to connect with each other. So I'm going to quickly share my screen to show you the webpage. This will just be a sneak peek at the webpage. All DRG members will be receiving the link this week, and then we will welcome any feedback from you, including on accessibility. The website should be fully accessible. Can I just quickly check, Ulrika or anyone else, if the screen is showing?
Showing okay, great, Kristen.
Super. So what we have on the screen here is the website for the reference group on inclusion of persons with disabilities in humanitarian action. Now we have three key areas in the website. We have under the About section, we have separate sections, separate pages for each of our 4 work streams. So we have capacity strengthening of humanitarian actors, mainstreaming inclusion across global processes, strengthening participation and leadership of OPDs, as well as supporting coordination mechanisms for disability inclusion in countries. So just to give you a sneak peek, for example, at Workstream 1, Capacity Strengthening for Humanitarian Actors, each of the work streams, we have an explanation of what that work stream is doing with objectives. We have some information on how you can contribute to that work stream, key priorities from our work plan. I won't go through in detail because of limited time, but then we also have the contacts for each work stream that you can reach out directly. At each page, of course, we have the link for anybody to join the group. Now, we also will have key resources. So this is something that we will be building up over time, but for now we have, just as an example, we will be sharing training materials, reports, good practice, guidance, and events. So just as an example of training materials that we can house on this website, we have the DRG training on Introduction to Disability Inclusive Humanitarian Action, which includes a number of different modules, including an introductory module, a module on the must-do actions, a module on accessibility, and so on. So all of that can very easily be accessed here, together with guidance and good practice. There will also be a space where you can contact us as DRG co-chairs. So we're really excited to be launching this. This website comes with thanks to support from Australia. I will stop there. We'll be sharing more information with all of our members. Please do join if you're not already a member. And I will hand back to Alradi. Thanks, Alradi.
Thank you so much, Kerstin, and happy to see that already the DRG itself is being launched during the Humanitarian Network and Partnership Week. And after a few years, and now we are launching a standalone website again in the Humanitarian Network and Partnership Weeks. So unfortunately, we will not have time as we already plan to have some questions and answers. But I'm sure you all enjoy the amazing intervention from the distinguished panelists we have today. And I'm glad to hear like different perspectives and from different angles how the coordination of disability inclusion could be better in the humanitarian humanitarian action system, and I'm sure this is a good it is a good reflection that we have that discussion today, and we will continue that discussion in particular within the DRG Secretariat, and I'm sure others platform will have similar discussion. And what we can highlight here that now we need to better coordinate at different level. And there is a lot of option, and there is a lot of challenges, and there is a lot of good practice. So how we can learn from all this and accelerate better coordination so we can have better and effective and inclusion response and humanitarian aid for all, including persons with disabilities and persons with disabilities from underrepresented group. So by this, I would like to thank all of you for being with us here as a panelist, and to the co-chair of the DRG, and for our colleague in the logistics, Elena Maria from IDA logistic team. And indeed, we will keep in touch, and we will share the recording for this session if some colleague already missed to be here. Thank you also for attending with us today, and hopefully that was a fruitful discussion for you as it was been for us as well. See you next time, and thank you for all.
Thank you, everybody, from my side, from either side. Have a good weekend.